What is a dental bridge? Dental bridges are an everyday dental procedure which is utilized to substitute the missing tooth or teeth that are missing from a mouth. It is comprised of a number of crowns which are fixed to the teeth that are on opposite sides of the space where the tooth that is missing or no longer were. The crowns serve as anchors to the fake tooth or teeth to complete the space. Types of dental bridges. There are a variety of bridges for dental use which a dentist might recommend depending on the position of missing teeth as well as the health of the adjacent teeth. The most popular types of bridges for dental use are traditional bridges as well as cantilever bridges as well as Maryland bridges. The traditional bridge is the most popular kind of bridge for dental use and is typically utilized in situations where there are teeth each side of where the tooth that is missing or not were. Dental implants or false teeth can be bonded to crowns which are bonded to the natural teeth on both sides of the gap. Bridges that cantilever are utilized in cases where there is just one natural tooth adjacent to the space where the tooth missing or teeth were. The fake tooth or teeth are bonded to a single crown which is bonded to the natural tooth that is next to the space. Maryland bridges are a moderate option, with the false tooth or teeth being bonded to either metal or porcelain wings which bond to the rear of the natural teeth one side of the gap. The procedure for getting a dental bridge. The process of getting dental bridges typically requires several appointments to the dentist's clinic during several weeks. The initial visit is about making the teeth natural, which will be used to support the bridge, by shaping them in order that the crowns will be placed over the teeth. Dental professionals will make impressions of the teeth in order to make a mold to fit the bridge. On the next appointment during the second visit, the dentist will install the bridge and adjust it if necessary to ensure that it is a perfect fit. The bridge is then delivered to a dental laboratory to be custom designed for the mouth of the patient. While waiting, the dentist can install a temporary bridge in order to shield the teeth and gums. When the bridge that is permanent completed, the patient can come back for another appointment to place it. The dentist will examine the fit and make any necessary adjustments prior to placing the bridge. Patients may have to come back for further visits to make sure that their bridge has been properly placed and working properly. Aftercare and maintenance. Following the installation of a bridge, it's important to maintain a healthy oral health to avoid gum diseases. It is important to floss and brush frequently and making sure to schedule regular dental checks as well as cleanings. Also, it is important to stay away from eating food items that are sticky or hard, which can damage the bridge. In certain situations, the dental bridge might require replacement or replaced if it is damaged or wears out over the course of time. It is usually performed by a dentist without the requirement for further dental preparation. The process of getting a dental bridge an everyday dental procedure which can to restore smiles and self-confidence. If you follow the correct procedures and instructions for aftercare, dental bridges can be used for a long time and offer a natural and practical solution to missing teeth. If you're considering purchasing an implant for your dental, make certain to speak with your dentist about the most appropriate option to meet your requirements.